All right, I've started recording. Welcome to video two, Supporting Prevention by Kyle Ortega. Pretty much in this video, we'll be discussing key points regarding prevention and maintenance of COPD. Some different things we'll talk about, excuse me, is lifestyle modifications, environmental changes, exercise, medication management, vaccinations, nutritional support, supplements, having that emergency action plan, um, regular checkup follow-ups with their PCP, and then educational programs. All right. So first, we'll start with lifestyle modifications. So the biggest, most important thing is smoking cessation. Most crucial step to quit smoking. The faster they quit, lesser damage, to their lungs, right? But so much easier said than done. The addictive nature of nicotine just makes this really, really hard to do, but we got to try. Um, Other support options include that behavioral support counseling, nicotine replacement therapy. Back to that support counseling though, it's needed. This can be so hard. You need somebody to talk to every step of the way, just just to help. You know, you're gonna have withdrawals. It's almost like a crack fiend. People don't know what to do without that nicotine. So having a behavior support counseling would be vital to success, I think. And then back to that nicotine replacement therapy helps with those nicotine withdrawals. We have so many products on the market today: patches, gum, nasal sprays, inhalers. Clinically, I see mostly patches. I have seen some gum, which is crazy. Um, but patches reign supreme, and I've seen people go crazy without patches. So I can't imagine the cigarette part. Um, but not having that cigarette smoke around just reduces that exposure. So, these are some lifestyle modifications that it's really, really hard. It's got to take a lot of will and fight from the individual to really make a change in their life. Environmental changes, avoiding those pollutants, whether it's airborne, secondhand smoke, staying away from any of that kind of stuff. A smoke-free zone in your house. A lot of cigarette smokers, they smoke in the house, around kids, all that messed up stuff. And if we could just cease that. Using PPE in exposed work environments. Like I said, alluded in an earlier video, working around chemicals and strong odors that's not good for our lungs. We got to protect ourselves. N95s, adequate ventilation and living space, maybe add a humidifier, but, open a window here, especially when it's nice out, like right now, opening windows here and there, having that good ventilation in your living spaces, managing your allergies. Here in Tennessee, a lot of people, there's just sinus allergies to, pollen, things like that. So on those hot summer days, spring days, when, the pollen's going to be real bad, maybe stay inside a little bit and then avoid those strong odors. A lot of those stuff we clean with are really strong. Um, we do like some people, those candles, the smelly good stuff in our cars, just avoiding a lot of these strong odors to really help your environment to better help with that smoke cessation. Regular exercise. Honestly, this could benefit the whole world, but for a COPD patient, this would be very, very integral part for them. So much benefits to physical activity. Exercise plans curated for them, which will most likely be something to do with pulmonary rehab, which we'll get into in later videos. Improving lung function, strengthening those respiratory muscles, enhancing your overall cardiovascular health. There's no such thing as exercise being bad for you. And when you have a lifetime of bad habits such as smoking. We can help enhance your overall health and lower those risks for cancers and COPD. And I'm not saying exercise is going to cure anything, but it can only help improve your health at the very least. Medication management. So your adherence to taking medications prescribed. When the doctors tell you to take this, that, it's best to do it. Whether it's the bronchodilators and inhaled corticosteroids, inflammatory meds, inhaled versus the oral meds, managing your symptoms and improving lung functions. It's pretty much the best you can do. Just follow the doctor's orders. Next video, we'll get into more of this pharmacology. I just want to touch on, just the patient's management independently on their own. Vaccines. Vaccines is another big lifestyle modification that helps prevent, further COPD complications. Annual flu vaccine, periodic pneumonia vaccinations, recommended to prevent respiratory infections that can exacerbate COPD symptoms. So that, along with practicing good hygiene to reduce your risk, washing your hands frequently, avoid close contact with anybody sick, following the flu season guidelines. All these things can really help. Nutritional support, never go wrong with a healthy diet. Um, that balanced nutrition, focusing on fruits, vegetables, lean protein, whole grain. It could help manage COPD symptoms, but just overall quality of life, lifestyle modifications, maintaining the healthy weight, managing stress, getting adequate sleep, reducing strain on respiratory muscle, all these things, they just add up to better life, sounds like to me. But big key here, it's not just physical and body and lungs problems, it's a lot of here mental as well, managing that stress, getting sleep, just reducing bad qualities that come with COPD. So nutritional support, definitely a big key. Supplements, discuss those potential vitamin deficiencies, see if your doctor, PCP could, recommend, I don't know, anything from, your multivitamins, fish oils, probiotics, anything that could just add to living healthy. Consulting with dietitian to really, really focus on your food intake. Emergency preparedness. So being able to recognize early signs of exacerbations is very key as somebody with COPD, especially if you're having a history of exacerbations. You need emergency action plan. You never, because you can't predict the future. You never know when the symptoms are going to arise. So emergency action plan for worsening symptoms, easy access to meds, um, contact info for the healthcare providers, oxygen supplies, all these things need to be right then and there. You got to plan for it. You got to plan life around it, wherever you are, especially if you're not at home. What are you going to do in an emergency situation? All these things have to be accounted for. And then regular medical follow-ups. So scheduled checkups with your primary care provider, spirometry testing, tracking those changes, which guides adjustment to the treatment plan, medication review, reviewing the effectiveness of prescribed meds and your adherence. Are you doing what you're supposed to be doing? Symptom assessment, discussing changes in your symptoms, you're looking at shortness of breath, cough, sputum production. Is there a certain time, place, and activity when these things are taking place? Is it exercise induced? In the last 2 years, are you Is it at least 3 months out of that year? All these things are very important in that assessment. Oxygen therapy evaluation, seeing if they need it, checking their SpO2, vaccines we discussed, lifestyle guidelines, discuss any emotional, mental health concerns, going back to that counseling, home environment assessment, making sure living space is good and eliminating any potential hazards, lung rehab programs, which we'll get to in further videos as well. All right, and finally, it brings us to educational programs. So patient education, understanding COPD and its progression, coping mechanisms, and stress management. It's very, very important, I think, for the patients to learn because, they don't know what they don't know. Support groups. I think it's very, very beneficial to connect with others facing the same thing. Having that emotional support and shared experiences. Like I said, it's not just physical, it's mental. It's hard to deal with. And having people there around you that support and create that positive, environment for you to grow and get better, especially if somebody's further along the line than you. It can help somebody, oh, if they can do it, I can do it. But just having that emotional support, I think is very, very key. So, all right, that pretty much wraps up this video. Thank you for listening.